Welcome to my YouTube channel PHARMAVEN. In today's video, I will be discussing about a scenario which frequently occurs during the USFDA inspection or any other inspection, and which sometimes misleads or gives a false understanding to the inspector that we are not prepared for the audit, operators are not ready, and we don't know our work. So let us understand the scenario and how we can overcome it. So what happens during the audit? There will be site rounds. So the auditors will go to the QC lab, they'll go to the production floor, they'll go to the packing area. So they'll visit the actual operating areas, actual operation areas, and they like to ask the questions directly to the operator or analyst who are actually working onto the shop floor. And they want to understand that really they know the processes or not, really they are trained or not, and that is their job. They need to make sure that the people who are working on the shop floor must understand that what they are doing. So in order to ascertain that, they directly ask the question to the operator and supervisor or the analyst. But what is the difficulty in this situation? Sometimes the operator or the supervisor or the analyst didn't understand the questions correctly because of the English accent of the auditor, or because of their lack of adequate English knowledge. So what happens? They do not completely understand the question and they try to answer the questions. So now what happens? They are not answering to the question which is exactly asked. They are giving a different answer. At the same time, the supervisor is there, the line manager is there, the senior leadership team which is escorting the auditors is there. So line manager will get it, he is not giving the correct answer. So he'll immediately jump into the conversation and try to give the answer on behalf of the operator. This is not acceptable by the FDA. They will consider that your operator is not trained, he is not able to give answer, hence your manager is coming and giving the answer. So how to correct this scenario, or how to handle such scenario? So if you feel that operator has not understand the question and is giving a different answer than what is expected by the FDA, just interrupt the interaction politely. Seek the permission of the FDA inspector that, sir, I think the operator or analyst didn't understand the question correctly. So may I correct the question, or may I ask the question on your behalf so he can understand clearly and then he can answer. So that is one way to do it. If inspector say yes, no, and most scenario they'll allow. They really want to understand the real situation. They don't want to have the answers basis on the misunderstanding. So they'll definitely allow it. Then you ask the questions in a simple English or in local language to the operator, and then ask him to answer the question. This is how such difficult scenarios can be avoided. Now what happens? There is a different scenario. That question is asked, operator is going to answer, operator is giving answer. Then if the supervisor or line manager feels that answer is not correct, so instead of waiting or instead of completing the operator's answer, he immediately jumps in, try to give answer on behalf of operator. So this is also not acceptable by FDA. If you jump into answer on behalf of operator, then it means the operator who is working day in and day out onto the line is not properly trained. He don't know the procedure, he don't know what to do and how to do, he don't know his own process. This gives a misinterpretation or misinformation to the FDA. In real life scenario, we know that operators are well versed with the OSFs and knowledge. They have their knowledge of processes, but because of fear of audit, sometimes they give the misleading answer, or they cannot correctly express what to do. So in this scenario, what you can do, politely ask inspector that, sir, he is giving or not giving the exact answer which is expected by you. He knows the process, but his terminology is not coming out correctly. So can I understand and can I answer on behalf of him, or can I assist in the answering? If inspector say yes, then you can proceed and you can understand from him and he give the correct answer. For example, if a microbiologist is asked that how many plates you read yesterday and how many were there with the counts, then he might have read 200 or 300 EM plates yesterday and 1 or 2 has a count. Then inspector will ask, give me the report where the count was there. Now the microbiologist in a hurry to give the answer, in a hurry to find the report, he'll go to the system, he'll start flipping the documents, and this gives the impression that he don't know where is the document is. So what is the correct answer to this? Yes, I have read 200 or 300 places yesterday. To find out specific one report which was with count, I need some time. So if you can permit some time, then I'll find it out and I'll show it to you. So this gives a clear understanding to the inspector that yes, he needs time because he needs to go through the entire file. Instead of giving this, the operator will start to find the file or find the correct document. Then what will happen? The FDA inspector will understand that he don't know where the document is, but he'll not realize that he need that time to search out that document. So this is how sometimes things go here and there during the actual audit. It is the responsibility of the senior team who is escorting the auditors to correctly drive the show. Above and beyond that, we have to train our operator and analysts and supervisors to first understand the question, digest the question. If they know the answer, then only they should start answering. If they don't know the answer, then it is absolutely okay that I don't know, I need to check and come back. If there is something specific to the SOP, you can always say I will check from the SOP and I will give you that parameters or data. But don't get very feared and try to give any answer. Just give the correct answer, and if you don't know the correct answer, please ask for the time, or please ask that you need to refer to them some document. So this is how a difficult scenario during an actual audit can be tackled, and it will give of course it will give a very positive sign to the auditors that yes, team do know what they are doing, and they intend to give the correct information to the inspector. So hope this small clip will help you to understand that how can better perform in an audit during regulatory inspection during site rounds. Thank you very much for watching my video, and if you like, you can subscribe to my channel. Thank you.